All right. So, welcome to Cutting to the Case, and I am here today with, and feel free to introduce yourself.
Hi, I'm Dominick Tuason, Assistant Professor of Orthopaedics at Yale Medicine in New Haven, Connecticut.
Absolutely. And thank you for coming, Dr. Tuason. And I'm Cameron Sabet. I'm a Georgetown M3, and I am here to learn a little bit about more about your career and your life. So we can start at the beginning here. You've trained at some of the most storied institutions in medicine, Hopkins, Penn, UPMC. But beyond the resumes and rotations, what moments quietly marked your decision to devote your life to pediatric spine surgery?
Cameron, thanks for that question. I think, I really was inspired from a young age to pursue a career in medicine, and probably reflecting on it was shaped by experiences that I had with the doctors that took care of me when I was a kid, particularly my pediatrician, and just the calming influence that she had, and wanted to be able to pay that forward by being that same type of soothing, calming influence on children and families when they are at their most vulnerable and anxious. And so always had an inkling that I wanted to go into pediatric medicine in some way, shape, or form. At Penn, I was fortunate enough to work at Children's Hospital of Philadelphia as a medical student rotating on clinical rotations, and really had the distinct pleasure of working with giants in the field like Jack Flynn and Woody Sankar, and remember very distinctly observing a scoliosis case that Dr. Flynn did. And that was really my entry into this field, and was really inspired by the surgery, but also the follow-up, and knowing that that child's life was uh, changed significantly and drastically by the power of that surgery. And so that's really what inspired me to pursue pediatric orthopedic spine surgery as a subspecialty field within medicine.
Yeah, and thank you very much for sharing that. That idea of long-term continuity of care, especially early on in life, is quite unique in the field of orthopedic surgery. And I am curious, you once said that, and I'm paraphrasing here, treating scoliosis isn't a one-time encounter, it's a relationship. So building off of what you said, in a career defined by that continuity, is there a patient or family that stayed with you in an unexpected way?
There's plenty of them, Cameron. I think the one of the ones that comes to mind is someone who actually maybe had a little bit of a kind of a rocky course, or maybe some unexpected occurrences during the perioperative period. But I think that I've benefited from learning from some tremendous people like Tony Herring from Scottish Rite Hospital for Children in Dallas, where I did my fellowship. And he really taught me the art of dealing with patients when they have unexpected occurrences or complications during their perioperative course. And I think that, interestingly, he's noted that a lot of times those patients and those families really become some of your closest friends, almost, in terms of the relationship you develop when you are allowed to continue to walk side by side with that family when they're going through trying times and unexpected circumstances. So, as I'm sure you're aware, scoliosis surgery is obviously very intricate and can be filled with potential complications or outcomes that may not be necessarily initially expected. But it's been a great gift to be able to get intricately involved with these families, and be involved with them for the long term.
Yeah, yeah. And I totally agree. It's almost as if these families become part of your team, where you're walking side by side with not only all of these other stakeholders in the operating room, but also the child and the parents, and even further, the anesthesiologist, the nurse navigator, the physical therapist. It really takes a village. In an era of increasingly specialized care and siloed care, how do you build and maintain that circle of trust around each patient?
Yeah, I think a big part of what we have done, and this is not necessarily unique to Yale, because I know a lot of the other big centers throughout the country do something similar, is that we have regular team meetings where all of those key stakeholders are involved at those meetings, and we are able to kind of in-depth review each of the patients that we're caring for on the surgical side of things, and preoperatively plan for their surgeries, as well as plan for the unique type of postoperative care that they will need based on their underlying diagnosis. And so I think that it is really important to have all those key people always present at those meetings so we can engage with one another, share ideas. And these meetings are really done under the context of quality improvement and trying to make care the best that it can be for each of our patients.
Yeah, yeah. No, that's incredible, yeah, no wonder that Yale outperforms in terms of quality improvement for orthopedics. So you've actually led national conversations on quality improvement, especially in the context of the Scoliosis Research Society. And I've been following a lot of your work here. In your eyes, what are the biggest levers that we have to improve safety and outcomes in pediatric spine surgery? Not 5 years from now, but today.
I think it's just a matter of continuing to get the word out that we owe it to our patients to strive for that idea of continuing to get better and better by reading up on the literature, by being up to date on the latest techniques, by being up to date on best practice guidelines to keep patients safe both before, during, and after surgery. And, I think that is, as a parent, I think my kids are probably tired of me kind of telling them all the time, 1% better every day, right? Just trying to hone your craft or whatever you're passionate about doing to make yourself a little bit better at it each and every day, to learn from opportunities that or disappointments that may come your way as ways to get better, and to always have a spirit of improvement, because I think we owe that to our patients. So I think that's the biggest thing, is just continuing to get the message out there, having a culture of self-improvement, of safety and quality. And, that really has been a big emphasis of the Scoliosis Research Society in recent years. And so I'm proud to be a part of that effort.
Yeah, yeah, and your efforts even extend beyond quality improvement and your work there to, this universe of complexity that's pediatric spinal deformity. Indeed, you've become one of its most trusted navigators, from magnetically controlled rods to metacasting to halo gravity traction. Your therapeutic arsenal is vast and growing. So how do you balance all of that quality improvement and the science of biomechanics with the art of timing and of medicine, deciding when to brace, when to operate, and when to wait?
That's a great question, Cameron. I think a lot of it just has to do with being a good communicator and really laying out the number of different options that are available to the family and to the child, and understanding that each child is unique, each family's circumstances are unique. And I think it just comes down to meeting patients and families where they are, and allowing them to have some agency and autonomy, and allowing us to come to a shared decision regarding what the best option is for their child at that given moment. So I think it really is, you're exactly right. Pediatric spine is inherently very complex, and I think that just being a good communicator who can break things down to easy to understand language that families can relate to, and know that we're going to do whatever we can and provide our expertise to help deliver the best outcome possible for their child.
And expertise it is. You've been one of the leaders, in fact, in personalized medicine and surgery. You've presented on 3D navigation at the AANS and American Association of Neurological Surgeons, and more specifically published on patient-specific instrumentation, which was certainly a first for me to really read in depth on that. So in that kind of context, what are the tools that you trust there? And where do you think we should draw the line between innovation and overreach?
That's a great question, Cameron. So I do think that we are entering an era of personalized medicine, and the patient-specific rod project is a good example of an application of that newer technology. And we're seeing more and more enabling technologies that allow us to do surgeries more safely. But I think that the key in determining which of the enabling technologies you're going to adopt and which maybe you're not, I think it really just comes down to studying it, right? And looking at outcomes and deciding whether the juice is worth the squeeze, so to speak, with regard to some of these technologies. Do they really move the needle in terms of improving outcomes without increasing cost so much that it becomes almost a moot point to adopt some of them? So I do think that one good example has been that use of 3D printed guides in scoliosis surgery. When we studied it, we found that the outcomes were not necessarily significantly drastically different than they were when we were using the tried and true freehand technique. And so we've been more selective about using 3D printed guides because they do come with an added cost. And I think that that's an important part of the value equation, right? So the numerator is the outcomes, and then the denominator is cost. And if we're driving up costs significantly, but not delivering much better outcomes, then I think that that becomes a line whereby I decide maybe we shouldn't adopt this new technology for the long term.
Yeah, yeah. And, you know, this same kind of balance applies to a lot of things, in fact, that you're researching, not just between the 3D printed guides versus the free-handed technique, but also opioid stewardship, the risks of prescribing opioids with the benefits of pain relief. So there's a lot of balance in your research, which I was particularly drawn to. And beyond that surgical alignment and those patient-specific rods, so what's a common thread that connects these projects for you? And what question are you still trying to answer at this point in your career?
So I think the common thread, Cameron, again, just goes back to that idea of trying to make our care better and more optimal. And so I do think that one of the most fun things for me is, analyzing where we are currently, looking back at adoption of new technologies and how they affect our ability to deliver the best outcomes possible, and having that spirit of continually improving and making things incrementally better. So I think that that's probably the common thread in the research questions I like to ask. I think that the big question with scoliosis, obviously, is that we still are not entirely clear on what causes scoliosis in the vast majority of the patients. So that's really the ever elusive question. And I think that I'm excited. I know that our neurology team here has some ideas about looking at the etiology of scoliosis here at Yale. And so we have some projects that are in the kind of infancy stages, if you will, with regards to getting those off the ground. But I do think that that's an important piece of the puzzle that we still have yet to understand completely.
Yeah, yeah. And really cultivating that spirit of curiosity is something that you've made central to your career, not just through research, but as an associate residency program director at Yale. And so you're a teacher as well. What do you try to instill in this next generation of surgeons, especially those who haven't figured out what kind of orthopedists they want to be?
Thanks for that question, Cameron. I think that among the things that I try to instill in the residents, it's very similar to being a parent, right? It's just trying to you have the same pride in the residents that you train, oftentimes, or similar pride as you do in your own kids, and seeing them succeed and seeing them thrive is really something that I get a kick out of as a residency program director. I think that one of the common things that I try to instill in them is really that with surgery, there are times where the job will be hard. And, I alluded earlier to dealing with complications. And I think that one of the biggest things that I try to make sure I instill in them during the 5 years that they're here with me is that having complications is an inherent part of being a surgeon. But what separates the good surgeons from the great ones are the ones who are able to tackle those problems head on and to be honest about them, and to basically really become closer to the patient when unexpected occurrences do happen, and to continue to promise to and pledge to be with them every step of the way and see them through it. And I think that that's one of the biggest things that I try to instill in our residents.
Yeah, that's beautiful. And the fact that you kind of likened it to a mentor-mentee or a parent-child relationship with the residents is really inspiring. It shows how much you care about this position and really about the program as a whole. As a father yourself, how has pediatrics changed the way you parent, or vice versa? Is there a moment inside or outside the OR that reminded you why you chose this field?
I think I am asked almost on a daily basis when we're coming to decisions in clinic about what the best option is for a given condition. What would you do if it were your child? And my kids are 14 and 13. So for a lot of the patients, it does, strike home, and, it's a very apt question to ask. And so I just think that it just goes back to kind of the golden rule of treating others the way you want to be treated, and treating others' children the way you want your children to be treated as well. And so I think it just goes back to that core value, and it's something that having honest conversations becomes easier when you yourself are a parent and you're able to put yourself in the position of the parent who's asking you, what do I do for my child, right? So I do think that they are coinciding themes.
And in the spirit of these coinciding themes in life inside and outside the OR, when you're not in scrubs teaching or reviewing manuscripts, what centers you? What lesson from your career in orthopedics, this highly decorated career, has quietly shaped the way that you live?
Yeah, Cameron, thank you for that. I would say that I would be remiss if I didn't mention that a big part of what drove me into the field of medicine from the get-go was a desire to serve others. And I think my faith has definitely helped shape my desire to choose medicine as a vocation. And that's a big part of what helps keep me centered, during the ups and downs that are inherent to a life in taking care of patients in the surgical realm. So that's a big part of what helps shape me, and a big part of my core values. So definitely my Catholic faith.
Absolutely. And Georgetown's a Catholic Jesuit institution, so we've been surrounded by a lot of different things of that nature, and bioethics courses, and that's really why I came there. So lots of very close ties there as well. So I appreciate you sharing that personal side, and that's really all that I have. If you have anything you'd like to share with the audience, feel free. Now's a good chance.
Well, Cameron, I just want to thank you so much for this opportunity. I know you were very accomplished yourself at such a young age, and it was a great honor to be a part of this. And I'm definitely, it's a great pleasure to just be able to share my story. And you're exactly right that mentorship and trying to teach the next generation of orthopedic surgeons is something I'm very passionate about. And the fact that you wanted me to come on to be on this show is humbling. So I appreciate you taking the time.
I really appreciate it. It was all too easy to find an amazing person like yourself. It was all too easy to just, you were a spotlight there, and I was drawn to it. So I really appreciate it. Thank you very much. This has been Cutting to the Case, and till next time. Thank you.
Thanks, Cameron.